So as Heather said, service level agreements and standard operating procedures are a component of your business plan. And so that's what we're going to cover very quickly over the next few minutes. For those of you who don't know, SLAs, service level agreements, are basically an ongoing reporting mechanism for measuring expected performance standards. And many people will think of service level agreements as something the service provider just kind of puts together and throws out there for the customer to view. And really, it's terms of agreement understood by both parties, the service provider and your customer or stakeholder, who these parties are going to interact and cooperate for a number of reasons. Completing a task, producing a result, supporting a third party. So really, these agreements can be very informal. So for example, me as a core director, we have a service level agreement which outlines a lot of the things that I'm going to talk about today. And it's an informal agreement because it's between my customers in general, and I'm not going to have each customer read and sign on the dotted line. But if you look at the service level agreements, say that our pathology department at the vet school has with the veterinary medical center, they're providing a service, so the director of the veterinary medical center signs off with the head of the pathology department for that service level agreement, so a little bit more formal. These can be between departments within a college. It can be a business and a particular client that they end up winning the bid to do their requested services. So multiple different levels of how legally binding this service level agreement is. So service level agreements accomplish a lot of advantages. And so first and foremost, they really serve as communication tools. And so they are meant to bring forth the shared expectations, priorities, concerns on both sides, the customer as well as the service provider. They will help to manage expectations. So if you prepare a service level agreement and it says that you can turn your service around in 6 months, but the client doesn't see that and the client really thinks that they could get it yesterday, obviously there's going to be a conflict at the onset, right? And because their expectations aren't met. So those, the second and the third go together, conflict prevention. So hopefully by communicating with each other and having everything outlined at the forefront, you can then decrease the number of conflicts. If conflicts do arise, the expectation would be that the intensity of those conflicts is weaker, and hopefully they can be resolved in a quicker fashion by having these in place. These really truly are dynamic, living, breathing documents. You don't just make one, have everybody sign on the dotted line, or stick it out there on a website and never revisit it again. And we're going to talk about that a little bit more. But basically, you want to have a mechanism in place to periodically review these, because there's going to be circumstances that pop up that are going to dictate changes to your operation, whether it's new services or new equipment that makes your turnaround time much quicker, things like that. So you need to periodically review this. There are also several things that SLAs will not accomplish, but many people, surprisingly, will look at these as a be-all, end-all. And so first of all, these are not mandates. You can't prepare this and say, the customer will do this, stick it on a website and forget about it. That's not going to work. You're not going to get your customers to do something that, they don't know that they have to do, or B, that's not reasonable. They're not get strategies. So oftentimes people think, okay, if I put a service level agreement in place and I put a business plan in place, we're going to make so much money, we're going to have so many clients. No, they're just not there to exist and have that ultimately happen. It's really a lot of work to have a sustainable, fiscally responsible operation that provides effective service for your clients. It's not going to stifle complaints, so it's going to help to minimize them, but it's definitely not going to stifle them. And if that's your thought process, you should probably get a different strategy, because it can often backfire and have the opposite effect. it's not a unilateral decision-making process. So as I said, I think oftentimes people as the service provider think, well, I just come up with this and they have to sign it, and if they don't like it, well, they can just go somewhere else. That's not how it works, right? And it won't be a quick fix to any issues that you're having in your core facility or shared resource. So as you approach putting this together, really, truly, it is a two-party agreement. And how totally involved the customer is in the preparation of this will vary depending on how legally binding your agreement is, or how few individuals are involved in this process. So before you even sit down to write this, you really need to think about who are your stakeholders in your operation. And there's going to be multiple stakeholders for most all of the types of core facilities we're talking about or that you all represent. First and foremost, customers. And so really, from our perspective, we prepare our service level agreement with the customers in mind. However, you might have to have multiple levels of service level agreements. You might have to have one between, for example, the Comprehensive Cancer Center and me as the core facility director. You might have to have one with your college. You might have to have one with Nationwide Children's Hospital. You might have to have one with whatever party is involved in the financial contribution. And so it really just depends what type of service level agreement you're trying to develop with a particular customer. So for the purposes of core facilities, moving forward and talking about these service level agreements, we're really talking about the customer that we're providing the service to moving forward. So how do you get that customer feedback to incorporate into that if we're not going to be sitting down with 100 different individual PIs to come up with a service level agreement? So before you prepare, it's good to have an idea of what the scope of your operation is by doing all of the exercises that Heather and others have gone through this course. But with regard to clients, then really the way that you're going to get their feedback is through feedback surveys. You may say, okay, I really want to find out about a particular issue. So you have a set of questions that are specific to things that you want to address. Heather's talked about user committee meetings that happen on a periodic basis. You can get feedback from those. You may send out informal one-on-one emails to investigative lab groups that you work very closely with, or client-patient groups that you work closely with. You may need to set up exploratory meetings with groups to gauge what their interest would be in new services or something like that. Don't forget to include the services that you include routinely, and also how would you deal with special requests. So for example, we provide immunohistochemical staining for investigators. And as Heather mentioned, we have a set of antibodies that we routinely offer. And those are going to benefit the greater number of investigators. If investigator X says, well, I need this very specific antibody worked up that's only useful to me, then we know that that's going to be a special request, and we have a separate fee associated with that. Other special requests might pop up, and you might not have been able to address them in your SLA, and so then that's again why you would have a periodic review to incorporate that. Also, don't forget about hidden services that you all provide. So for example, we will routinely help people. We do basically autopsies on the animal models that are used here on campus. And so they might not have the financial resources available to autopsy all 150 mice that they're going to use. And so we will have them bring one of their mice over, and we'll train them on that one mouse. Bring two. We'll train them on the one mouse, then they'll do the second mouse while we watch, and then they can go back and they can take it from there. So we don't charge them for that necessarily, because we're trying to advance the probability that they would come back and use us in the future for things, and so we don't do that. But that should be a point that you cover in here, that we do offer training, or we help with manuscript preparation. And if you provide a figure for a manuscript, you may or may not charge for every last minute of your time for that, but that's a hidden service that you should include in that. So when talking about service level agreements, there's two main components. The first slide here is going to represent the service elements. The next slide that I'll show you represents management elements. And this is where it really helps to kind of go through, this whole exercise helps you to go through and look at your operation very comprehensively. So with regard to service elements, you want to talk about the services that you provide. And when we talk about all of these things, it's really think realistically, okay? This helps you kind of figure out in a realistic way, would we like to provide every single service that anybody would possibly want to ask us for? Well, sure, because you're in the customer service business, right? But what can you realistically do based on the equipment, based on the frequency that would be requested, based on the expertise of your staff? Service availability. So hours of operation. Are you a 24-hour operation, or are you really only Monday through Friday during the workday that the university is open? How do people schedule services? So for example, as I just indicated, we're going to get live animals submitted to us. So we need to put things in there that you can't just show up on our desk, on our front doorstep unannounced with 50 animals. You need to schedule this, right? And it may be scheduling time to deliver animals or blood samples that are time sensitive to get processed, or it might be scheduling equipment. So you need to put all of those considerations in there. Priorities. So as somebody brought up earlier about if a PI purchases equipment, then they might get a higher priority level. Or it may be that people who come in and say, they need this for a grant that's due on such and such a date, maybe you work around with them to address those priorities. But what you want to make abundantly clear from a core facility perspective is poor planning on their part does not constitute an emergency on your part. So outlining all of this information in a service level agreement hopefully helps to address those things. Workflow. How is workflow going to go through the lab? They might think, oh, I just drop an animal off and then a day later I get a full pathology report on full tissue sets. They don't understand the complete scope of what you provide, so you need to spell that out for them. Submission process. So many of you may be familiar with eRAMP, which is what the Cancer Center uses. We have another online application that we use for submission, which is interfaced with eRAMP. And so we outline what the procedure is for submitting their samples. And obviously we have to speak about blood samples, which are time sensitive, live animals versus fixed tissue, things like that. Research, the result and the provided product. So sometimes it may be that you're providing sequencing data that then has to get turfed over to bioinformatics or something. So then maybe the SLA is between those two cores. In our case, we're providing PDFs, we're providing Excel spreadsheets, we're providing a number of JPEGs or TIFF images, and all of those get uploaded so that the investigator has direct access to that in its archive. So we spell all of that out, how we provide, what kind of product we're giving them and how we give it to them. Also a component here is storage and retention. So it never fails that we will deliver some photographs to somebody and then 7 months later they're like, oh, I lost those files. Now we can say, oh, well, they're on our online application still, just log back into your account and you'll find them there. Now, how long are we going to keep those there? And so that's something that you need to consider. And so I think we said 7 years, but it'll also be an issue when IT ultimately comes to me and says, you don't have any more space, right? So But we got around this whole concept of uploading it and having it be archived there because people weren't keeping their results, and then it was taking up more of our time for them to bring the slides back and us to take more pictures, things like that. What's your turnaround time? And again, here you need to be really realistic. It can't be, well, the investigator wants it to be in 2 days, I'm going to provide it in 2 days. And different categories of your services may have a quicker turnaround time. Pricing and billing, this is the fee and there's no negotiation. Or we can negotiate. If you follow the Omni Circular, A21, whatever the fancy schmancy name is nowadays, you pretty much have to go by the books there, and that helps tremendously because investigators will really try and negotiate if they can. And then really outline the responsibilities of both parties. And so, for example, we need a required set of information on these specimens from this investigator. We need it to be uploaded to this system. We need fiscal approval to happen before we can initiate execution of the services provided. And we need them to pay our bill. And then in turn, we will provide this. Management components. So really this is looking at service effectiveness, problem resolution procedures, and the change process. And so this is really more on the core side. And service effectiveness can be handled in multiple different ways. One way that the Cancer Center automatically does is once the service is completed and billed, the user then gets a survey that says, how was your customer satisfaction, basically. You can look at this from a turnaround perspective, so lots of different things. Just make sure you outline how you're going to look at whether you're providing service effectively, and then that you report what your effectiveness is, and if there's any issues with that, how are you going to address them. Problem resolution procedures are really important. I think you need to outline that and frequently tell customers that. They might grumble, and if you probe further, oh, what was your problem or issue with that, then they'll come to you. And we routinely have people who come to us, they'll get a histology slide, and they'll say, oh, this stain is horrible, you need to repeat it. So my histology lab supervisor will come and say, well, why is it so horrible? And when I look at it, well, there's actually perhaps a lesion there that they didn't know was a lesion, and they were interpreting it as an inappropriately stained slide. So make sure that you kind of talk through these issues with your customers, but outline what the process is for them to follow so they understand. And again, nothing is set in concrete. These are dynamic, living, breathing documents. So make sure that you have a mechanism in place to review your SLAs frequently, review and revise. So you guys will get a couple of different templates in the materials that they'll send you afterwards. One of them is a template that we use that's from the Cancer Center that I really like. And so this just kind of goes over some of the broad categories of things that you'll include in there from the template that we use. Purpose and scope, statement of legal authority. Here, this is where we say, this is what the Omni Circular, A21, whatever, stipulates that we have to do. And in addition, for example, our Corps has MOUs between our department and our college for different aspects of our operation, and so you might want to allude to those as well as in your business plan. What are the services that you're going to provide, and what are the fees associated with that, and how frequently are you going to do a cost analysis, scheduling and sample submission, responsibilities with regard to data that's generated, sample retention and quality. The quality side is usually often from what is submitted will depend on how great the product is that you can produce, right? Turnaround time, billing and payment, feedback, again, problem and dispute resolution, and then points of contact. This should be abundantly clear for both sides, customers and the provider. So hopefully, I know this is super fast. I've demonstrated the benefits that SLAs can have. They do contribute to understanding of customers' needs and priorities. They will hopefully put into context customers' expectations so they're a little bit more on the same plane. Consistency between the two parties in evaluating the effectiveness of the services provided, context for focusing on continuous improvement, a framework for assessing and improving customer satisfaction. That should be our goal always. Less time lost resolving conflicts, and hopefully those that do arise, they will be less intense. And really an increased opportunity for long-term supplier and customer relationships. So we want to have lifelong dedicated customers who will go out and say, oh, you should go to this core facility, right? Because they really have a high level of service. There's a lot of resources out there. This is the best online resource that I have found. And this Naomi Carton has quite a bit about service level agreements on her website, in addition to a PDF that's many gazillion pages long that you can download, as well as some books that are available for purchase. But a lot of what I covered is represented in her handout. SOPs. So many of you are probably aware, especially if you work in any type of lab, of standard operating procedures. And so really these are going to describe regularly recurring operations with the ultimate goal of executing these operations correctly and consistently so that you can hopefully maximize the safety and operational efficiency of your core facility. They say that anything that's done more than twice in your facility should have an SOP. Now, as represented by this cartoon, hopefully you guys can read it, basically you can get SOP fatigue though, right? So if you have SOPs for absolutely everything, people are going to ignore the SOPs. So you need to be selective in this. And these should also be available wherever the work is done. So it shouldn't be that you prepare SOPs for a particular piece of equipment that's used, and then the SOP is stored in the director's office in a 3-ring binder that collects dust, right? It needs to be where the work is actually done. SOPs are systems dependent. They are not people dependent whatsoever. So somebody in your facility who is actually doing whatever you're making the SOP about should be the one to prepare the SOP on that. And they really compose of clear, detailed instructions that are based on past experiences. So if the supervisor in the lab has done this test 150 times and knows that this is the most likely step where people will mess up, then they can put a caveat in there about how to avoid that misstep. Use plain language though, because really the goal of these SOPs is that anybody off the street somewhat could come into your lab and could follow this SOP and do it. And so the best example of this is my med tech will prepare an SOP on how to run a blood sample through our hematology analyzer. So I know enough about the process that if everybody in the lab calls in sick that day and somebody shows up unannounced with a blood sample, that I should be able to take that SOP and run it through there. Explaining key terms, of course, to those who might not understand them. But really, anybody should be able to understand an SOP. Keep in mind what the overall purpose is of your SOP. And so for the most part, as a core, we're usually using these for training purposes and to ensure safety. Sometimes in larger corporations and industries, you're using them to ensure compliance standards are met, perhaps in a CLIA, in a clinical lab that has to follow CLIA standards, you need to work into their, that compliance is met and things like that. But in other industry settings, it might be to maximize production requirements and things like that. But just keep in mind, so we use them for the most part from a perspective of training. So a teach one, do one, watch one, basically. All right, there's multiple categories of SOPs. We're not going to go into this. The basic thing that I just want to deliver to you is there's going to be a fundamental SOP which describes the whole process of making an SOP. And we're going to go into that a little bit more. Then your other SOPs are really whatever category that you need to address. And there are going to be multiple SOPs will be related to each other, and we'll talk about how you can cite other SOPs. But you may be describing how to run a particular test. Then you might also have an SOP on how to run a particular piece of equipment that's used to process that test. You might have to prepare a reagent that's used to put into the machine that's used to run that sample through. So you have multiple SOPs that are going to relate to each other. And you might also have some on how are we going to check the quality of these slides that we make. We are going to look at every fifth one and check the staining quality or something. So you might have an SOP for that. How are you going to deal with complaints? You might have an SOP for that. So really, what SOPs you want to make are going to depend on what you do in your facility, but these are just some ideas to help you get going. So how do you put together an SOP? There's really a tiered structure for an SOP, and you're going to start out with what the purpose and the scope of that is, and what are the prerequisites and qualifications that are needed. So do you need 3 different pieces of equipment, a set of reagents in a particular sample, and then can anybody in the lab run that, or can only a med tech run that? So, define the personnel responsibility. So we get the sample from the customer, and then we start running things through, or some other individual has to do something to that sample first before you get it for the purposes of this SOP. Make sure that you outline all the related SOPs, which we kind of just talked about. Defining words, terms, and acronyms are really important because, again, anybody off the street, a layperson, should be able to do this with some training. Outline the overall processes. And you want to make sure that you allow for deviations from that process. So it might be you can only run a sample through this machine if it's plasma. You can run it on serum if you do certain things to the machine, like washing it 5 extra times or something. So if you outline that and who you have to go to get approval for deviating from the SOP, that's important. Then you get into the step-by-step instructions. And they, who are the SOP powers that be, say that you shouldn't really have more than 12 steps. Well, I think it really just depends on what do you have to put in this SOP in order to communicate how things should be done. And so I wouldn't focus so much on the numbers. It's really just what information is in there so somebody could take it and follow the instructions. If there's any pertinent references or equipment manuals or anything like that, make sure that you reference those, and you might also have some attachments. So that fundamental SOP of how do you make an SOP really includes multiple things. So who can or should prepare which type of SOP? Probably the head of the core facility is going to set out how to make an SOP. But it would be, does the supervisor does the head of the core facility charge the supervisor of the individual sections of the core facility, and then the supervisor assigns a certain tech in the lab to do that? Who's going to review the draft? Who's going to approve the whole procedure? Once the SOP is approved, who is going to determine the date of implementation? Who should be informed? So does everybody in the lab get informed, or do only the hematology technicians need to know this information? And then, because these are living, breathing, dynamic documents as well, how are revisions to be made to this process? And also importantly, what if you no longer have that piece of equipment and so that SOP is null and void? How can you withdraw it and make it inactive so people aren't worrying about it? So that initial fundamental SOP should really outline all of this. And then the others will really address the step-by-step for that particular process that you're trying to document. With regard to the individual SOPs that are prepared and approved, you want to make sure that on that first or title page, you have the name or signature of the author of that SOP and the date of the approval with the name and signature of the authorizer. And then make sure you have a header or footer on each page so you know what that is, in case people are printing it out and having binders and then you drop the binder and all the SOPs come out and you're trying to keep things all together. If you have these, the unique title and the page numbers, total pages, and it's on each page, it will help you. Just to put in here too that it's helpful if you kind of think about these in terms of categories within your lab. So we'll have them for clinical pathology, anatomic pathology, histology. So we kind of break them out into departments within our lab, and then also more administrative SOPs. So you can think about the categories that relate to you best. Again, review at regular intervals and make sure that you are updating these and that people understand what the updating approval process is. And then lastly, make sure that you maintain a list of all of your SOPs. It's helpful. You can do this in as easy as an Excel spreadsheet. Organize it by numbers or alphabetical or whatever works best for your OCD-ness, or cross-reference them if you have to. I like to include the date that you requested an individual to write it, the original approval date, and then current version date or number. And you might know that, oh, I indicated that this should be revised, and so it can be in revision, and then once it's approved, you can say revised, things like that. So coming to how do you prepare these, you guys will get 2 templates. I think one is a template that I use, and another is a template that I found online that are basically Word documents. But I know in this, so I guess in terms of being an old school, I'm old school that way because I'm still functioning from Word. But there are multiple applications. You can get really sophisticated with some of these things. And so I just indicated a number of commercial applications, some of which you can demo for free, some of which are free for academic institutions, things like that. Some of these are pretty cool in that you can incorporate images and you can incorporate flow charts, and you can assign responsibilities to different individuals. And then most importantly, you can log on from anywhere to see them. And so that helps if you have multiple different sites and you're like, oh, well, do I want to keep a book at each one and then have to worry about updating and making sure that the most up-to-date version of some of these SOPs and in each book? No, if you do everything electronic and they can access it at one shared site, then that kind of helps. So multiple different, and there's probably more. This is just, I would find some information about a few and then it would lead me to some other places. I know we went over, I'm sorry. Hope you guys will get these slides. Don't hesitate to email me with any questions about any of the other stuff you guys learned. I eat, drink, and breathe this stuff on a very frequent basis, so happy to help because I know it's kind of rough going when you're starting out trying to do all this. So, any questions? All right, I know you have evals to do and you want to get out of here. Thank you.
Sorry again for going over that.
No, who knew that?